welcome everyone who's joining us, everyone who will be joining us. My name is Mo Brown. I'm Anna Kellis's campaign manager, and I have the honor of introducing our prestigious panel. So first, I'm gonna start with our moderator, Dr. Anna Kellis, county legislator and candidate for the Assembly District in the 125th District. Next, I'm gonna introduce Kathleen Bergin, JD with the Disaster Law Project. I'm also going to introduce Dr. Jamie Loehr, author of the Vaccine Safety Book and co-author of Raising Your Child. And last, I'll introduce Dr. Snedeker with Northeast Pediatrics and the Cayuga Medical Center, as well as Pediatrics and Infectious Diseases. So Dr. Anna Kellis, the floor is yours.
Thank you guys so much. I really appreciate this. I know there's been a lot of conversation about community health currently, I think brought even further to the fore, being in the middle of a global pandemic that for many of us, majority of the world, none of us have experienced firsthand before, many of us. And so I wanted to bring a panel of experts together to talk about this topic. From my own experience as a trained epidemiologist, I've been getting a lot of questions directed at me in particular, but I think that it's always helpful to bring a group together so that we can discuss this. So this is informal, intended to be informal. We have a list of questions, as you guys have all seen. So I'm focused on moderating. Yes, my background is epidemiology, but you are all the experts centrally in this area. So I will be more in a moderator role, asking those questions and make it more of a conversation, a fireside chat style. So thank you all so much for taking an hour of your time to do this and coming together for the whole community. This is a perfect example of community service. So thank you so much for your time. I can jump right in. One of the first questions that I have gotten from constituents, and this is not just during this campaign, but actually during my time as a professor at Cornell and my time as a legislator, trying to educate on what is truly an infectious disease in comparison to chronic disease. What is an infectious disease and how does it spread? So I know, Jeff, you are an immunologist by training and doctor. I'd love to hear your take on that.
Well, quite simply, an infectious disease is something that you can catch from either somebody else or from your environment. It's something external to you that enters your body and causes illness.
And with respect to the spread of infectious disease?
Different infections spread in very different ways. So there's some infections that spread by droplets through the air. Contamination of hands is a very common way for infections to spread from person to person. There are infections that one can acquire from the environment, like from soil or contaminated water, from animals. So the devil's in the details, as always. Different infections have different details in how they get around.
Right. Yeah, I mean, it's very different than a chronic disease fundamentally, because chronic diseases are things that develop because of lifestyle in your body. That is an area that I focused on more, like obesity leading to heart disease or coronary heart disease or cancers. But there is a gray area, of course, because there are some infectious diseases that can ultimately later lead to risk of certain chronic diseases. So there it is a mix, but the fundamental difference is the origin or the cause of the infection. So I think one of the things that I've been communicating a lot to people is, when we talk about community immunity, the initial response that I get is, the thought that it needs to be 100% of people, that 100% of people have immunity in order to prevent spread, and trying to communicate that distinction that, as you described, there's a myriad of different viruses, for example, that cause an infection, like a infectious disease. And some are more virulent than others. Some are more intense, some spread more quickly. And depending on the rate of transmission would impact the number of people that you would seek immunity for in order to prevent spread. That's generally how you would describe that?
Sure. There are some infections where community immunity or herd immunity is completely irrelevant. Tetanus is a good example of that. That's something you get from your environment. So whether people around you are immune to it or not has no impact whatsoever on your own personal risk. But there are other illnesses where very obviously having immunity around provides some shield against your being exposed. Measles is a great example of that. And of course, we're seeing now with COVID what can happen when you have a population that is completely susceptible to an infection where there's no herd immunity whatsoever. Nobody has seen this before, so anybody who's exposed can get it.
Right, so that actually is kind of the context in which we're in now, where everyone's personal responsibility with respect to community health, the distancing, being on pause, staying at home. What is the role that you feel, Jamie and Jeff, the role that the community plays in the context of an infectious disease in particular? And more specifically, what is the community role in preventing the spread of a virus that you see, and particularly in the context of COVID right now?
So some of this, again, depends on the severity of the disease. So if this was a common cold and it was spreading around and people were sick for 2 or 3 days, we wouldn't be making a big fuss over it. And so the community would just all get it. No one would have seen it. It would spread around and it wouldn't be an issue. So the issue is that COVID happens to be a very deadly disease for some people, and it can make them very sick. And so while many people will get the illness and not be particularly sick, the people who can get it and get very, very sick can die from it. So then it becomes a responsibility to try to make sure that the people who are at risk for it don't get it. And then you also just have generally bad luck outcomes. Some people who are not at risk, who are very healthy, can still get very sick from this. So then, because it's a dangerous disease, we actually are trying to protect them as a community, as opposed to a mild disease that we don't really care about.
That actually brings me to another thing that I've been hearing. There's the, some comments of we should all go about our business so that we all get it and we can build immunity and move about our business. And what you're saying, I feel like addresses that a bit because of the severity of the illness and that it is deadly for some people.
Right. So if no one was going to die from this, then we'd all go about our business and that would be fine. But if 1% of people die and we have 300 million people in the United States, that's 3 million people dying just so we all get community immunity. And that's a cost that many people are not willing to take.
The other thing to factor into that is what the impact would be on our healthcare system if everybody got this all in a very short period of time. And that's really been one of the critical reasons for instituting social distancing, is that even if we don't have a vaccine, even if right now the only thing that we can do for people who have this illness is to support them and try and get them through it, if we all get this within the space of a few weeks, which is what we were on the way to happening, then hospitals and doctors' offices were, we saw in other parts of the world, were completely overwhelmed by this. So the biggest impact of social distancing may be less how many people get this in the end, as over what period of time do we have all of that illness happening.
Right, and that also brings up something else that, a lot of the conversation is centered around essential workers. So for example, in hospitals, you have, you have nurses' aides and patient advocates who already, are essential workers. They're always going to show up guaranteed. They're the least well paid. So they're already struggling, already on some, social services. And then you have them showing up and and then they're in the highest amount of risk. And if the population, the amount of COVID, explodes and is in the hospital setting, we're maximizing the risk to, populations of essential workers, which exacerbates systems that were already strained, it seems. And that's another thing I know a lot of people have been focused on and trying to, we talk about flattening the curve. Part of that is also to protect, the frontline workers, and it's really important, I think, to remember that. And actually, the concept of flattening the curve, I think many people understand it now, but I'd love to hear you talk about it a little bit, so that maybe people could understand it from, I can also touch on it, but from a medical perspective, either one of you would be wonderful, I think.
Jeff brought it up very nicely, is that if everyone gets sick at the same time, the hospitals and society are overwhelmed. And we saw that in New York City, and we saw that in Italy, and we saw that in other places. And then the routine care that needs to happen gets pushed out, and the hospitals don't have enough supplies and services to take care of all the sick people at once. Mm-hmm. So if you have 1,000 sick people and have to take care of them in 1 week, that's much harder than taking care of 100 sick people a week every week for 10 weeks. So flattening the curve is spreading it out over time so the hospital is not overwhelmed.
Right. And I think that, here in Tompkins County, although it's been very difficult, economically, for sure, we have seen a real, I think, severe and beautiful flattening of our curve here. I think we're at 140 cases maximum. We could have had many, many more cases here. And the thing that is important is the rate, or the incidence rate, that the number of new cases per day is very low. We have many days recently where we've had no new cases. And that is the perfect indication. It's not just the number of cases. And I hear that a lot from people. Well, we still have 140 cases and it's staying at about 140. But that's the prevalence. That's the number of cases that we have in existence right now. But it's the new cases and the number of new cases that we're seeing. And I feel like it's important to note that when we say flattening the curve, that's really the number of new cases has really, dropped, and it's almost at zero right now in Tompkins County. So we've done an amazing job of that here. One of the things, Jamie, I wanted to ask is a bit, if you could share with us the history and role of vaccines specifically. And then the second part of this is, does everyone need to get vaccinated to protect the population? We touched briefly, but.
So the concept behind vaccines is that you're using your own immune system to protect against a disease in the future by being exposed to a weakened or a part of the illness or the disease or the vector, so that you are getting practice in treating yourself for the illness in the future. And what you're trying to do is to say, I have got a measles vaccine, I've gotten a mild case of measles in my body, I will be able to fight it off better, and I will not actually get the disease severely when it happens in the future. The original goes back to Edward Jenner, when they found out that cowpox, if you were to get cowpox, you would be then immune to smallpox. This was in the 1700s in Great Britain. And so he deliberately gave someone cowpox and then exposed that child to smallpox, and that child did not get smallpox. And so this was a formal test of something that people knew anecdotally. With regards to how many people need to get vaccinated, I think Jeff might have more information about the percents that need for different diseases.
Yeah, it kind of depends, again, on what disease you're talking about and how it's transmitted. But for illnesses that are highly infectious, things like measles, for example, you have to have roughly 70% or so of the population immune against that illness, meaning that they cannot get it if they're exposed to it, in order for the rate of that disease to drop to low levels. And what it's really about is how likely is it that somebody who's actually sick with that illness can pass it on to somebody else. So if you have an illness like measles, and if you are surrounded by people who are immune, it's harder for that virus to find somebody who is susceptible and who can then catch the illness and pass it on to other people. But viruses like measles always have to be in a living human being in order to survive in nature. They don't hang out in, on inanimate objects. They don't have any animal hosts. If everyone in the world became immune to measles tomorrow, the measles virus would disappear completely from the earth. So, and you don't have to have everybody immune, but you have to have almost everybody immune so that the odds when anybody is sick that somebody who is susceptible will be around them is very low.
Yeah, that actually brings up a really, really important point, and something I personally am quite passionate about. And so it's a great segue into, can you describe in the context of this, this arena of vaccinations, the importance of medical exemptions, how it's identified, how you identify it, what its role is in this, and importance?
Sure. So that there are some situations where vaccines can cause people to become ill. We know that all vaccines have side effects, that most of those side effects are minor, and in all of the cases of the vaccines that we recommend people get, the risk of harm from the disease is far greater from the risk of harm from the vaccine. Otherwise we wouldn't be doing it. But there are some individuals, if we're giving them a vaccine that can actually cause illness, and if their immune system makes them more susceptible to illness from the vaccine, their prior illness, their underlying medical condition, then that can be a situation when they should be exempt from that vaccine. It doesn't necessarily mean that it's in their best interest to be exempted from all vaccines. For example, the case of tetanus that I mentioned earlier is one where even if you have an immune deficiency that puts you at risk for complications of a vaccine like measles or chickenpox that involves a live virus, you can still perfectly safely get tetanus vaccine and protect yourself against that. So it's an example of how important it is for people who are worried about whether a vaccine is safe for them to get to discuss it with their healthcare provider. And if they have an underlying medical problem, or if they take a medication that affects their immune system, their provider can advise them which vaccines are still important and safe for them to get, and which ones should be avoided. And if they need to be avoided, then their provider can explain why the reasons are, and they can create an exemption for them if it's a vaccine that's required.
So I know that, well, so I have two question follow-up to that. One is, have you experienced cases where you're working with children who are severely immunocompromised and have autoimmune disease, so they're in sort of a constant state of inflammation, where you would recommend an exemption across the board for vaccines that could potentially cause an immunoresponse, an inflammatory response?
Sure. I have a couple of patients who have autoimmune disorders that it isn't so much the disease itself as their treatment for the disease that makes them, that compromises their immune system. And some of those children cannot receive certain vaccines that I would really like for them to have, but it isn't safe to give it to them. So for them, it's important that people around them be vaccinated so that they're protected. But even those kids are still able to get most of the vaccines that are recommended for all children, because most of those vaccines are perfectly safe, even if their immune system is weakened. And in fact, in that situation, it's even more important for them to get those vaccines, because their immune system is even less well to protect them from those natural diseases than an average child is.
So the medical exemption was modified in this last year, I think, a regulatory change. Was that, am I misunderstanding, Jamie?
Yes. What was changed in 2019 was that New York State removed what's called the religious exemption.
Right.
In the United States, there are 3 categories of exemptions. The medical exemption, where it's not safe for the child to get a vaccine. The religious exemption, which exists in many states, which say if you have a religious belief that you are not allowed to get the vaccine, the state allows you to not get the vaccine and still go to school. And then there's what's called the personal or philosophical exemption, which says, I just don't believe in this vaccine, and you don't have to get the vaccine and still able to go to school. New York State did not have the philosophical, but did have the religious exemption. In 2019, it removed the religious exemption from the state law. And so now only exemptions that are allowed to attend school in New York State are medical exemptions.
Right, and I had read a bit about regulatory modifications to the medical exemptions that people who were previously exempted for across the board can now only be exempted for one at a time and have to get the first vaccine and have an adverse reaction to it in order to exempt from that. And is that?
That's not quite accurate. It's not an exemption. What they removed was the religious exemption.
Yes, that part I understand. Yes.
So families were then required, if they wanted to send their children to school, they had to get the vaccines in order to go to school, and they had to start the process. If the child had a reaction at that time, they could then petition to possibly get a medical exemption. But you don't get a medical exemption when you've never had the vaccine unless you've got an underlying medical reason to say you don't need the, it's inappropriate to give the vaccine.
So there's still the option, the religious aside, because that we already know, but within the context of the medical, if there is an underlying medical issue and that would create a compromised immune system, as Jeff described, there is a pathway to exempt from vaccines.
Absolutely.
Right. And that hasn't changed. But it is important to say that even if you have an immune system that is compromised in some way, there are still many vaccines that can be safely given. And even it may depend on your level of immune suppression, and milder forms of immune deficiency. People can still receive even live virus vaccines under certain circumstances. A great example of that is HIV infection. That's the premier immune suppressing illness that we know about. And yet children who have HIV infection with either mild or very little immune involvement from HIV can still get vaccines like measles vaccine. And in fact, they should, because it may protect them from that illness down the road when their immune system is weaker.
And Jeff, if I'm correct, if a child's getting chemotherapy, you'd still be giving them certain vaccines.
Absolutely. Yeah. For example, influenza vaccine is strongly recommended for all children who are getting chemotherapy every year, because it's a perfectly safe vaccine to give to a kid who's immune compromised. And it may protect them from an illness that could be especially harmful for them in their weakened immune state.
And in their weakened immune state, there are vaccines that would potentially impact their immune state, and others that would not. So that is a particular case where you would evaluate.
Right. And for children like that, it may be that the vaccine will be somewhat less effective for them than it would be for a kid who had a healthy immune system, but it is still to their benefit to get that vaccine, even if the vaccine is not effective as it might otherwise have been.
And that brings up actually a tangent on this that is not, in the questions that we laid out, but I think is really important, which is we, in this COVID era, the original thought of wearing masks was to protect yourself. And we had to do a lot of education of the community to help people understand that the mask isn't to protect yourself from getting diseases from others, but rather to protect others from getting the disease from you. And so there's been some discussion with vaccines, particularly in the context of community immunity, that it's very important, particularly in school settings where children are very close to each other, engaging, constantly, very close, that those who are healthy getting vaccinated creates an environment where those who are immunocompromised are safer. So in some ways, having vaccines is analogous, that it is protective for those children who are immunocompromised and can't get all of the vaccines. Some of them, but not necessarily all of them. Would you agree with that?
I would agree, but I would say as a parent, you know, the argument that I should vaccinate my child to prevent others means far less to me as a parent than what does it mean for my own kid. I mean, that has to be acknowledged. And I would never recommend a vaccine for a child solely because it would protect other people if I didn't feel it was in the best interest of that individual. That always comes first.
Absolutely, and I think that that's really important. And what it touches on is the the balancing act between public health and public policy, and the medical recommendations. So from a public policy standpoint, the recommendation, for example, for mandatory vaccines in schools that are have the caveat of the medical exemptions is done for a community-based protection and isn't focused on the individual. And then the ability to create the medical exemptions or recommend and have those recommendations and have doctor discretion for those is that pressure valve in the context of public health policy that is created through a legislative pathway. So, it's that tricky balance for sure.
I would make a small caveat on that. The public policy is a public health benefit, but as Jeff says, it's also an individual child benefit. And so when you're making a law saying that everyone needs to get this vaccine before they go into school, it's a law in my mind like everyone needs to be in a car seat or a booster seat or wearing a seatbelt. It helps society, but it also helps the individual. And I don't want to lose sight of that.
Absolutely. Absolutely. And I think the reason why I really wanted to have this conversation is that it's all true and it's all nuanced. And when you put them together, then that creates a comprehensive understanding. And I find often, because this conversation can be very intense and very emotional, the nuances and all the pieces being put together simultaneously can get lost. But this conversation shows the level of nuance to this topic that I think is really valuable to play out and to hear. So I had another question for you, Jamie. I've had conversations with some constituents about practices with vaccines. I know some countries, they give vaccines individually. Some group them together. Advantages and disadvantages. I know you've researched that. I'm curious what your thoughts are on it.
So the way I talk about this in the office is being a lumper versus being a splitter. And I'm a lumper because I believe that giving the vaccines all at once has no increased risk of side effects, with one rare exception, and has fewer times that the individual child will be crying and coming into the office and being scared about the office. There is one known exception where a combination vaccine has a slightly higher risk of fevers than separate vaccines. And the CDC has commented on that and made suggestions about that. But in general, there's no increased risk of side effects doing them together versus doing them separately. So doing them separately causes delays in when they get the vaccines. And doing them separately means more visits to the doctor and more injections at different times when the child is crying. And so that's why I believe in doing them together. I'm not sure of the rationale in other countries why they would split them up. And they probably have their reasons, and I just don't know about them.
So if you have a patient who presents who's immunocompromised, would you do them individually so that you could assess potential impacts of any individual one?
The short answer is no. I'd have to look at the immunocompromised and see specifically what vaccines are recommended for that. And there are national guidelines along that. But I would still say that the benefits of doing them together and decreasing the number of times they get the injections, times that they're crying, and delaying the vaccines would outweigh spreading them out. However, we always want to listen to the family. And so I have had times when the family refuses and won't do the vaccines unless they have a different schedule. And I, in the end, compromise because it's more important to get the vaccine in than it is to stand firm on that rule.
It's very important to, if I could add to that, Anna,
yes,
it's very important for people to understand that in order for vaccines to be recommended in combination, it has to be proven that they work just as well when given in combination as they work separately. So for every combination vaccine we give and for every group of vaccines we give, you have to prove scientifically that the immune response to each of those components individually is just as robust and just as effective as it would be if you gave those vaccines separately at a completely different time. So we know when we're giving these vaccines in combination and reducing the amount of pain and the amount of suffering the kids have to have, that they're working just as well as if we gave them spread out. And as Jamie already said, spreading out means that it takes longer to get the job done. And most of the vaccines that we're giving to younger children are for diseases that are most threatening to them in their first year of life. And so every month matters, every week matters in terms of getting those vaccines on board on time.
And you brought up, thank you, Jeff, that's very helpful. You brought up, Jamie, I think you both have touched on this, scheduling. What is the discretion that doctors have for scheduling, working with currently in the system, working with parents?
As Jeff said, the proof has been shown that the schedule that's recommended works. So when you go off schedule, you don't have the same confidence and proof. But discretion is I'm not the one who's making the decision on giving the child the vaccine, so I have to also listen to the parents. And so I have to respect the parents' choices and renegotiate if necessary if I can't convince them to follow the regular schedule.
Right,
and I
do
have
the same thing in my practice.
Wonderful. I have a question from a person following. Now urgent care in Ithaca is offering antibody tests for COVID. Do you know what the reliability of this test is? I believe I had COVID in DC way back in January. If I have the antibody, I would love to know.
So it's a really good question. There are many different antibody tests out there, and some of them are more reliable than others. The one that is available through the local urgent care is pretty reliable. I mean, it's upwards of 96, 97% accurate.
Oh, wow.
If you have detectable antibodies, it means very likely that you had COVID. But I would stress that we don't really know a lot about what that means. That, the main reason people want to be antibody tested is they want to know if they're going to be protected from future illness and if it's safe for them to be around other people who might be vulnerable. And unfortunately, we don't yet have the answers to those questions. It may be possible, even if you've had COVID and even if you have antibodies that protect you, if you get exposed to it again, you might still be able to pass it on to other people, even if you don't become ill yourself. And we also don't know how long that immunity is going to last for. There are a number of other coronaviruses that we get quite regularly that cause common colds. And while they behave differently from the new coronavirus, we do know that immunity to them is relatively short-lived. So when you get a cold from one of the other coronaviruses, you can get that coronavirus, again next year and still get a cold from it. So we don't know yet if it will be possible for people who have already had COVID once to have it again. I think it's pretty likely that they may, although hopefully it'll be much milder when their immune system recognizes it from the first time they had it.
Well, and I think that brings up a really good point of understanding viruses themselves. The rate at which they evolve is almost incomprehensible to the human mind because they reproduce so quickly. A lot of people will talk about that with the flu, the strain that we have. We hear that a lot about the strain that we have this year, and do we accurately capture the strain and create a flu shot for that strain? But by next year, we may be seeing another strain, and I think that is also part of what you're speaking to, which is we don't know whether or not the immunity that is created by having this one will protect in future from variants that we may see. And we don't know how quickly it will evolve because of the magnitude in which it is experiencing hosts. And that, of course, then it can accelerate that. So.
And fortunately, so far, while there has been some genetic variation in the new coronavirus, so you can track, for example, based on those mutations, whether the virus has been from China or Italy or whatever, those mutations don't seem to affect fundamentally how the virus behaves or immunity to it so far, as best we understand. So different viruses behave differently in that respect too. Flu is the prime example of a virus that mutates and changes very rapidly, and there are some particular properties of the flu virus that result in that I won't bore your audience with. But suffice it to say that flu can change shape very rapidly and make it difficult for your immune system to recognize it. So far, that has not been the case with the new coronavirus, and it's not the case with the other coronaviruses that have been around for a long time either.
Yes, which is actually one of the pieces of good news we've gotten so far. So I think it's really important to highlight. I've gotten another question. It seems like the numbers in Tompkins County in the last few days have added a few more positive cases. Although numbers are small in a small community, isn't this a warning that COVID's still, quote, alive here, and we shouldn't get lazy?
I definitely agree that we shouldn't get lazy. I think the increased numbers of cases may be because more people are getting tested. In the last week, because of the highly publicized employee at Green Star and the number of people that may have been exposed, a lot more people have gone for testing than would have gone before. And most of those people aren't sick, but some of them, a small number have proven to have the coronavirus. It does make the point that there are some people who have this virus who have not been made ill enough by it that they realize that they have it, and can potentially spread it to other people. And that gets back to the social distancing that you were talking about earlier and wearing the mask to protect others. People are assuming that if I don't feel bad, I can't possibly have this. And we know that that's not true.
Right, which, the transition from only getting tested if you have symptoms to also adding the essential workers and now adding the general public, that those changes themselves, and we know Tompkins County has had a very high rate of testing compared to other counties, and we have the ability now to do batch testing. I know that the Cayuga medical system is ramping that up with the Rheonics machines that they have, which batch testing is that you take a batch of samples at a time, and you test them all at once. If it comes out negative, then you don't have to retest them. If it comes out positive, then you individually test them. But that way you can rapidly increase the rate of testing, and we can now do testing locally instead of sending away to a lab. So we have the ability to continue to ramp up our testing here, which may show more positives by the nature of that. So it's a really good point. I wanted to transition to Kathy. Thank you so much for being here and your patience. But as a constitutional lawyer, I did want to touch on a few questions that have come up in the community, particularly in the context of mandatory vaccines in schools, and the question of whether or not it is a constitutional issue, takes away constitutional rights. From your perspective and understanding of constitutional law.
Sure. So from a constitutional perspective, the issue of vaccine requirements has really not been an issue for over 100 years. It was settled in 1905 by a Supreme Court case that came out of Massachusetts, and that state had passed a statute requiring everybody to receive a smallpox vaccination. And if they didn't receive the vaccination, they would be subject to a $5 fine at the time. And that was challenged by an individual who said he had some bad experiences of previous vaccines, and he argued that it was his constitutional right not to get the vaccine and not to be penalized for it. And the court rejected that argument. And they said there are some times when the community health interest will override the claims of an individual under circumstances when there really is no harm. And in this case, as well as every other case that I've looked at on the issue, it's not a situation where the state is forcing anybody to be vaccinated. And that's why I tend to not use the phrase mandatory vaccines. You always have a choice not to be vaccinated. For example, school vaccinations, for example, the penalty for not vaccinating your child is they're not going to allow you into the public schools. If you are a healthcare employee, there are circumstances where the facility you work at is authorized to rescind your offer of employment unless you agree to certain vaccinations. But those legal requirements don't mandate that you agree to the vaccination. They're just not going to allow you to work in highly volatile environments where you could spread the disease. So that issue has really been determined for a while now. There were subsequent cases that reached the Supreme Court after that 1905 decision, where the court actually said, we're not going to even argue with the details. We're just going to dismiss the claim because everything on this issue stems from that 1905 case. Important to note as well that the issue that both Jeff and Jamie have talked about regarding individual choice, that's actually wrapped into the constitutional analysis, because the courts have also said that even when a vaccine requirement is passed by a state statute, there needs to be an exemption for individuals whose health would be compromised by the vaccine. And those circumstances may be rare, but the court understands that in that situation, the state really doesn't have a compelling interest in harming an individual if their goal is to protect the community health. You're not protecting the community health if you injure someone by forcing them to undertake a vaccine. So these issues about community health are paramount, but they also take into consideration the nature of an individual's choice.
Yeah, I've heard from many people that specifically it's taking away choice. And there's also, and I know you and I have spoken about this, but because you aren't criminalized for not vaccinating your children, that's also, there's no criminality in this. And so, right?
That's right. And I think from the court's perspective, it's not an issue of taking away choice, because you are still presented with a choice. The choice is to refuse the vaccination, and there's no criminal penalty associated with that under any state law that I'm aware of, or to forego a government benefit. So the choice is really whether or not you want to partake in the benefit, not whether or not you are being forced to relinquish your choice in the vaccine, right? You're not guaranteed a government job, for example. You are not guaranteed the right to a public school education. There are conditions that are placed on that. From the court's perspective, a county is not required to let you into their school system if you live somewhere else, right? So a county is also not required to let you into the school system unless you comply with the vaccine requirements that they think are necessary to protect the public health. But the choice still resides with the individual whether or not to get the vaccine.
I think that's, for me, I think that's the most important because, there's the two camps. There's the camp that talks about it from a medical perspective, but there's the camp, and I find a lot here that talk about it from the ideological perspective and the constitutionality of it. And I've heard, arguments that it's sort of a slippery slope. And the one thing that I've heard it compared to is abortion rights, and that it's the same, my body, my choice. And I think I'm curious what everybody's thought is. All three of you, your thoughts on the comparison with that. Kathy, from the legal perspective and constitutionality, how those are different, and then of course from the medical perspective.
Yeah, well, first I would say nobody's requiring anybody to get an abortion. That's obviously up to them whether or not they want to do that. But again, I would go back to this issue of sort of framing where the injury comes from. And, the courts have said that governments are allowed to take positions on important policy issues. And that's a strange way for folks to think about it. But the government does this all the time, right? The government invests in public education. The government invests in democracy building programs. The government invests in public health programs. And it's these issues about vaccines really align with that philosophy, and that the state and the federal government invests in measures that are designed to keep the community and the individuals healthy. And the way they're doing that is taking a position on whether or not vaccines should be encouraged. And they are allowing states to determine, based on scientific evidence, that if a certain number of people are not vaccinated, then that creates a public health risk. And so that's a choice that the government is making, but it still allows individuals to decide for themselves whether or not they're going to accept the government's benefit.
Thank you. That's very helpful. And Jeff and Jamie, I'd love to hear your thoughts from the health perspective of that comparison.
Well, I think it's apples and oranges, and I think abortion is a very different animal. I think of it more is that we want our government representing us to be able to provide us some insurance that we are protected from harms from our neighbors. And maybe a better example might be a highly infectious illness like tuberculosis. In the absence of government public health regulations, if the person who lives next door to me has tuberculosis, I would like for them to be a way for the government to say, you can't be out on the street until your infection is no longer contagious. And that infringes on that person's individual rights to some extent. But it does so because their being out on the street is an infringement on me. It puts me at risk. And so that person's individual rights have to be balanced with the risk to those around them. And there's a long tradition in public health with many different illnesses where we have entrusted our state with certain powers in order to protect us from each other in a way, and to protect people from being irresponsible when they have conditions that might pose a threat to others.
Yeah, thank you so much. Jamie.
An example of that irresponsibility is that you have the right to drink, you have the right to get drunk, but if you're driving and drunk, you're harming me and you're putting me at risk. And so there is a law that says you can't drink and drive, and that infringes on your rights because you would like to be able to do anything you want. But the government has the right to say, you can't do everything you want if it might harm other people. You can just sort of put it as a perspective. Your rights are not complete because you live in a society.
Right. And that last point is so, I think, pivotal. And it's that hard edge balancing act. If we choose to live in society and therefore choose to have a government that sort of oversees that the underlying basic securing of safety, then we are agreeing to in some ways then give up some of that independent choice in order for a collective society to work. And that is that tricky role of government to walk that fine line, but in exact way that you're describing.
And that's what the Constitution has said, Anna. A lot of people will say, well, you know, if you look at the 14th Amendment, for example, it says that no state shall deny any person life, liberty, or property without due process. And some people would argue that that's a flat textual guarantee. No state can deny my liberty. And that's not quite what it says. It says that no state can interfere with your liberty without due process. And courts have interpreted that language to involve the precise type of balancing act that we're talking about here. Nobody's rights are absolute. They're always balanced against other individuals' rights, against the state's interest. And depending on the importance and significance of the interest, a court might require a greater compelling interest on the part of a government, for example, as opposed to just sort of a toss of a coin. That's where things get very tricky and very nuanced. But when it comes to individual liberty interests and privacy interests, the courts will always involve some kind of balancing analysis and not take an absolute position on somebody's individual rights.
Yeah, thank you. I see, you know, we're coming towards the end of our hour, and I'd love to bring it back. That was answered, I think, a lot of the questions that I had. We are in a global pandemic. It is a unique experience, and you know, it's bringing up a lot of fear, a lot of anxiety, a lot of reflection, but also a lot of hope, a lot of inspiration. A lot of people are I think, searching for creating community in very creative ways to flatten the curve, to work together, which is something I deeply appreciate. And I feel like this conversation has been so important because these have been a lot of questions, but also roadblocks in allowing for that collective building towards you know, coming back to a state of health and coming back to a state of, you know, being able to open our economy and being able to open our communities. So thank you so much for that. But I would love if you could each share, you know, you have the bully pulpit, and you know, we're in this situation, and I would love to give each of you sort of an opportunity to share what would you like to say directly to the public in the context of community health in the age of COVID. I'll start with Jamie.
I would like to say that vaccines work. And I want people to remember that. And we're actually glad that they work. That when people get vaccines, they have fewer chances of having the illness in the future. And nothing in life is perfect, but vaccines do a good job of protecting you in the future. And so I'm glad that they're there. And I'm looking forward to when we get a COVID vaccine, because that will help protect society and help us protect individuals.
Thank you.
I would say I've really been heartened by the tremendous outpouring of public spirit that I've witnessed during this time. That, you know, people seem to have understood that we are stronger when we all act collectively. I mean, when people find a common goal and work towards it, it's really been astonishing what has been accomplished in terms of flattening the COVID curve. There's been pain and suffering that has come as a result of that you know, people are struggling with, and that definitely has to be acknowledged. But I guess my thought is, I think coronavirus is going to be with us for a long time, and I hope that sense of common purpose persists as the epidemic wears on, and that we continue to try and work as hard as we can to help one another.
And I'm going to ask two of you before I let Kathy close for us. One question that has come in just now as we're winding towards the end. What would you like to see with respect to the safety with the COVID vaccine being developed, working through? What process would you like to see in place to ensure that?
Well, I think what I would say about that is that there's no shortcut to safety when it comes to vaccine development. And there are many hurdles that will have to be surpassed before a COVID vaccine can come into widespread use. You have to show that it works, of course, and not just that it helps you make antibodies. You know, the recent news story about a vaccine that, you know, people got antibodies when they got the vaccine. Well, that's great. We don't know if they're protected from the illness yet. That's a whole nother question. We also have to know that a vaccine is safe, not only when it's being developed, but after the ramp up of manufacturing happens. You have to go back and you have to make sure that, you know, with all the complexities of manufacturing, that you still have a product that's just as safe and effective as when you tested it. And then we also have to expect that a vaccine may not be perfect. It may not be 100% effective. It may have some level of side effects, as all vaccines do, that will have to be weighed against the benefit that we get from it. This is another area where, Anna, you've said many times tonight, there's lots of nuance. And I think a lot of the nuance is completely absent from the discussion about vaccine development. It's going to be hard to do this and it's going to take time. But I think the worst thing that we could possibly do is rush a vaccine out that hasn't been proven to be safe or effective and then have harm come from the vaccine. That would not only be a disservice to people who are looking for protection from COVID, but it would also jeopardize the whole public discussion about vaccine safety.
And trust and collective, absolutely. Thank you so much. I think that was extremely important to get into this conversation. And Kathy, I would love to hear your thoughts on.
Yeah, great. So I think those comments from Jeff were really insightful, and that's something that I think about because I'm not a public health professional. So I put my trust in the experts. I am a professor of disaster law. And before I started teaching disaster law, I taught constitutional law for over 10 years. And that's my son, Kieran. Hi. Just sit down, honey. So I look at this. So I look at this from a government accountability perspective. And I want lawmakers to do what's in our best interest, and I want to hold them accountable when they don't work in our best interest. And one of the things that Jeff is talking about is the issue of transparency. So for me, I trust the medical experts who say vaccines are generally safe, given all these caveats we need to be concerned with. But my issue is, who gets to make the decision of how much government money is going to a company in order to make a vaccine? I want to know why those companies are being chosen. I want to know whether or not the scientific claims that they're making have been vetted, not by politicians, but by scientific public health experts. And I want to know that whatever good comes from these efforts is going to be available to everybody in the community. And right now, of course, we know from all the reports that COVID is not affecting our communities equally. It is especially devastating to poor communities, communities of color, indigenous communities. And so I want to make sure as an issue of transparency that the vaccines and the treatments that become available are accessible to folks in those communities. So I look at this from a government transparency perspective, and those are the kinds of issues that are on the forefront of my mind.
Absolutely. Hear, hear. Thank you. Kathy and I had that exact conversation earlier. And it's not just that, but it's the accessibility and making sure that the accessibility is not unequal, so that you have some communities who are disadvantaged communities who are not receiving it over other communities. So it's not just the safety, but it's the rollout. And thank you. It's hugely important. And Jamie, it looked like you had a last.
Nope. I think Jeff and Kathleen did a wonderful job explaining it.
I do too. And, in those final comments, I think were so critical to get into this last hour. One, absolutely safety, that we're putting safety first, that we aren't rushing this. I think that's a fear, Jeff. That's certainly a fear that I've heard. And I think that it's really important that we are loud and clear as a collective that is unacceptable. That we really do need to see the clinical trial process continue to be thorough, that it isn't giving undue privilege to certain industries over other, or certain companies over other, or there isn't a conflict of interest as we're seeing at the national level right now. I think that that absolutely needs to be addressed. It's totally unacceptable. And also making sure that there's equity in this entire process with access and education. So thank you both so much for communicating those two final points. I think they're absolutely critical. I wanted to thank all three of you. You guys took an hour out of your time. All of you, thank you so much. Thank you for your expertise, your commitment, your heart, your passion for this. And mostly, more than anything, your interest in educating the public and holding the public, and your empathy. So thank you, all of you, so much for this evening.
Well, thank you for giving us a forum to do it, and it's been a pleasure.
Absolutely. My pleasure. Anytime. Take care, everyone.
Bye-bye.
Bye.